I am so excited about this talk. Mental health, needless to say, we're all affected by it in so many ways. So let's just jump in. I could talk forever about this, so let's just jump in. Could you each describe your origin story and what were your journeys of coming into the space?
Yeah, I'm Gayle. I'm an emergency medicine physician. I think that my intro into climate started when I was a child. I grew up in the Sierra foothills. I remember vividly wildfires and like having to get ready to evacuate my home growing up. And so this was my like very start into the climate space. Departed pretty hard going into medicine, it felt like, and then went through wilderness medicine and austere medicine and like EMS, pre-hospital work. And through this, and also going into emergency medicine, which for me is all about health equity, found the space of climate and health, which is this combination of environmental justice, health equity, and it brought me back to like being outside, being in the outdoors, and being able to connect in that space.
So I have a little bit more of a circuitous route than Gayle, but similarly starts where I come from. So I grew up in an area just outside of Denver, Colorado, and with the Rocky Mountains as a backdrop and Colorado's strong outdoor culture, I think I developed early that underlying climate consciousness and connection with nature. And then I started, and in college, I then studied ethnic studies, which gave me the opportunity to learn about social justice movements in this country, and particularly social injustices that are driven by historically unjust and racist practices. And at that same moment, I was working with a local AIDS organization in my community, looking at the disproportionate impacts, negative impacts of HIV and AIDS on Black and Latino women. And kind of the dots just started to click from there. Like all these issues that I was studying, these social injustices were the same social drivers of health, negative health outcomes in communities overburdened by social injustices. And so that was kind of the driver of why I wanted to pursue a career in medicine. And as I was then going through my medical training, I'm now a hospice and palliative care doctor. And for those of you who don't know what we do is we support patients and their families as they navigate life-limiting and terminal illness. And I was seeing, their patients who have chronic disease and terminal illness that are exacerbated by issues of climate change and climate-related disasters like extreme heat, flood, hurricanes. And it all connects with social injustices. So climate change is a social justice issue. Climate change is a health equity issue. And so I really needed to be more proactive in that space. And so I kind of, along with Gayle, we decided like we are engaging in this climate and health fellowship for clinicians. And I was able to then this year work with communities and build those community partnerships and really kind of elevate their voice in that respect.
Wow, that is incredible. Thank goodness for you both. So the solutions that you're working towards in your work, they also seem to be good for our health. But can you talk more about this? Like, what are the health benefits of climate mitigation and resilient solutions?
Yeah, so do you want to talk a little bit about what we're doing in fellowship, just so like you have a little bit of So I'm working with FEMA and the Environmental Defense Fund. With FEMA, I'm looking at the impacts of extreme heat on Alaskan Native health and doing this from a community-based perspective. So working on conducting interviews and surveys with people on the ground to understand what they're experiencing. Like we can sit here and we can do climatologic data gathering and we can sit here and we can do all of this modeling. And as was mentioned earlier today, looking at permafrost and glacial melt, and we can see this happening, but how is that being experienced? How are people living with that every day? And so I'm trying to understand that and try and focus on those things so we know how we can best support people in this space. The other group that I'm working with is the Environmental Defense Fund, and the main project that I'm working on with them is looking at tree canopy in urban settings. And so again, looking at social justice and environmental justice, the folks who are in areas that are least covered by trees are those who are also marginalized in many other ways and are bearing a great burden of social injustices. And so how can we introduce more tree canopy to protect against heat and to protect against air quality issues and bring those sort of like, we'll talk a little bit more about climate and health co-benefits, but that's kind of the space that we're looking at there.
And I'm working with currently the City of Denver's Office of Climate Action, Sustainability and Resilience. And with them, I'm working particularly with a couple of under-resourced and overburdened communities in Denver that have like power plants, have like transportation infrastructure that is affecting their air pollution. And my role has really just been to kind of be that soundboard for them, like that person who can provide that health lens, but really listen to what their concerns are and really listen to what their proposed solutions are, because really they do have this, they live and breathe in that community. They know what to do. They just need a little bit of maybe technical guidance, or just like, again, maybe that health lens to kind of leverage their solutions to the right players and really bring them to the table. So that's kind of been my role, is being that community partner and listener.
And as far as like climate and health co-benefits, so when we're looking at things like practices that decrease greenhouse gas emissions, so decreasing car emissions, and then again with urban greening, adding in tree canopy, if you decrease your greenhouse gas emissions, you decrease not only your CO2 emissions, you decrease ozone, you decrease nitrogen compounds and other organic compounds that are in like combustion engines and that sort of thing. And those are directly linked to things like asthma and other respiratory illnesses and heart illnesses. And so by decreasing people's exposure to those, you are also improving their health. And the other sorts of things, increasing green spaces, promoting infrastructure for active transport like biking and walking, we see not only decreased emissions, but we also see huge health benefits from just engaging in activity. And there are plenty of studies. There's one particularly in Barcelona that looked at if you make space for these sorts of things, if you add in the infrastructure, you add in the green space, you promote active transport, you're seeing huge numbers of preventable death. You're seeing, and it's related to not just like taking cars off the road and decreasing emissions, but also like noise reduction and just being in green space.
You know, that makes so much sense to me. I'm listening to you, and I spent a lot of time in Vancouver, Canada, and they have that so much. And as much as I didn't love living there, in that way, I really felt the benefits of that. So climate change disproportionately affects overburdened and under-resourced populations. What role can healthcare professionals and institutions play in advocating for and implementing climate and health policies that ensure equitable health outcomes for all communities?
So I think the big thing is, one, listen to communities. 2, listen to communities. 3, listen to communities. I think so often a lot of the climate mitigation and resilience strategies tend to be prescriptive. And we don't actually truly listen to these under-resourced communities and hear what their concerns are. And also like how, like when people or organizations or things, people are prescriptive with solutions, they're not really taking into account how a community lives day to day. So that's incredibly important, to listen to their voices, to listen to their knowledge systems. This is especially true for Indigenous populations, and Gayle can speak more to that. But really making sure that we're listening to communities, we're bringing their voice to the table in existing power structures. So we as clinicians have like a very privileged space, but we deal with these patients and listen to their stories and listen to their concerns, and we have the ability to kind of elevate their voices and make sure they're in the right spaces to like pitch their ideas and concerns and solutions. So I think that's a big part of what we can do, is just be that kind of, help them navigate this and elevate their voices.
Yeah, I mean, I agree, right? Like, this is all about the people. And, like, that's what all of this is it's all about the people. And I think that part of, this was kind of alluded to earlier, is like a lot of the early environmental movement was like, oh, let's save the polar bears. But no, we need to save ourselves. And, like, the planet will recover. I think there's this old George Carlin quote that's like, the planet is fine, the people are fucked. And like I think about that all the time, and like, how can we address that? And it's totally by listening to each other and by serving each other's needs and seeing those people who are under-resourced and being like, how, like, what do you need? What do you need? You tell me. And then not just what do you need, but like allowing them to have agency in the conversation and like recognize the importance of self-determination. There's so much power, and I think everyone in this room feels this, right? There's so much power in being able to take action on your own behalf. And so if we're sitting here, again, being prescriptive in our solutions, we're removing that agency from people. And so finding ways that we can support people in self-determination and finding their own path to help themselves as well, I think is incredibly powerful. And that's something that we do all the time at work, right? Like, we're having these conversations with patients, or like, this is what's going on, like, these are the ways that we can manage this, but like, what's important to you? And it's always like the values of a person that I think are really important to consider.
And just kind of bringing that full circle, I think by doing that, helping communities get that sense of agency, feel that sense of community and belonging, it really empowers them and improves their mental well-being, which again, all relates to climate and how, you know, that eco-anxiety, the increased rates of depression that people are experiencing because of climate change. By engaging in these solutions that empower people and that give them that sense of agency, really improves their mental well-being.
Absolutely. And so, speaking of that, what are some of the best practices for engaging and educating populations about the health benefits of climate action? Like, what are the things that we can take away?
I mean, I think we just need to talk about it. Yeah. And I think that this is still, the healthcare system in general, medicine in general, is still kind of new to this space. Like, a few years ago, medicine showed up and was like, this seems bad. And it is, right? Like, people are dying because of this. And so we need to, like there's tons of data that exists. And this kind of, again, gets to that, like, how do we tell this story? And I think that part of it is we're really lucky in our fellowship. We get to be around these clinicians all the time. There are a lot of people who are engaged in direct patient care who are super passionate about this and are looking for ways to tell our stories. And like, we're all scientists, we're not great at it, but we're trying. And so like, I think that like for us being here, this is really exciting to be here with you guys because there's so much potential to just engage in this. Like, how can we tell this story? How can we continue to teach people? And then I also talk about it with patients at work. I'm like, you came in, your asthma is bothering you today. Why do you think your asthma is bothering you? And they're like, oh, I don't know. I'm like, well, it's really hot. Like, it's unseasonably hot today. And that makes the air pollution affect you more. And those two things are why you're here today. You didn't do anything, like you've been taking your medications appropriately, you didn't get sick, you've gotten all your vaccines, you're doing really well. But like, what happened is the space that you're living in. And so just like, I try and teach people just quick little things that I can do. I mean, I work in the ER, so I'm not seeing patients long term, and I don't have that ability to build those relationships. But even just those little conversations, I think, are really meaningful.
Yeah, and to kind of go off of that too, just having, like, once you engage those patients and talk to them, and once they're aware, having them tell their stories and having them tell their health-related stories is really powerful, because I think, you know, early on, people think about climate change as, you know, saving the polar bears and glacial melt, which is super important. We've heard all about that. We're all, this space is very privy to like that kind of language, but health is something that everybody cares about. So making sure that we're kind of elevating that story and having patients tell, because that's what makes people care about climate change, right? It's the stories, and health is such a compelling angle. It's you know, the most important thing that we all have. So that's another thing to just make sure that people are, once they're aware, to kind of keep sharing.
I love that. You know, we do have some extra minutes, so maybe we should just open it up for any questions. Yeah? Do you guys have any questions for these ladies? Anything in particular? Anybody? Oh.
Hello. So you when you explain that to some of you, the people that come in, just in this really politicized world, even when it's affecting their health, are you seeing some pushback? Because there's so much, there's people that denied that the vaccine worked and all this kind of stuff. How do we avoid that with even having because it seems that people are skeptical even when there's someone that studies something their whole life and they tell you this, people now feel so emboldened to be like, I don't know, I think you're wrong. So how are people reacting to that when you tell them?
I mean, I can say from my perspective, and then Gayle from an ED perspective, I think it's probably a little bit different, but I sometimes don't even use the words. I don't attribute things to climate change because people see what's happening to them, right? So, for example, with the wildfire smoke in the Northeast, it was affecting a lot of people's existing respiratory conditions and asthma, and people can see that. They can see the smoke, and we can explain to them, like, oh, don't you notice that this is happening a lot more frequently? We're having a lot more wildfire breakouts. We're having like extreme heat events, things like that. And people are seeing how it affects them. And so just kind of talking about that and giving them that space, but not necessarily using the words climate change. Because honestly, I don't really, I've come to this space where I don't really care about the attribution of it all. We believe the science, but if people get to the same outcome and people get to the same solutions that I care about with regards to climate change, then it doesn't matter if they believe the science or not.
Yeah, I would just echo what Nisha said. Is for the past 5 years have worked in very conservative places, and it's just not using the word, right? We don't say climate change. We say it's really hot. It wasn't this hot when I was a kid, when I grew up here. And so right? But people think about that and they're like, oh, it is getting hotter. And even if, like Nisha said, even if they're like, oh yeah, it's not because of climate change, it's just getting hotter, at least we can agree on that. And at least we can try and find solutions for that. And so it's just I think Catherine Hayhoe's book talks about this a lot, right? Which is how do we find that common ground? And sometimes it's just in the language that you choose to use. What's her book called? Saving Us. Yeah. I always get it because there's All We Can Save and Saving Us. Both of them are fabulous books.
Any other questions? Oh, yeah.
Okay, I don't know if you kind of answered this or you didn't. It's me.
Oh, sorry, babe.
You want someone else?
No. After. Yeah.
Okay, so personally, I notice that when the weather is extreme, it gets hot and then it gets cold and it gets hot, my body hurts, or I don't know if it's because I'm older, but it hurts, or I feel like people are getting sick more because of that rapid change. In LA, it's freezing and then the next day it's hot. Is that in my head? Or when I say to my kids, it's weather, when you're having horrible allergies when you don't even have allergies, is this all associated to climate change?
Oh, absolutely.
Okay.
Yeah,
I just wanted to make sure I'm not crazy.
Yeah. Yeah, air pollution. So, for example, extreme heat. It reacts with the chemicals of air pollution, creates ozone, which is extremely, it makes respiratory conditions worse. And then it increases, pollen seasons and certain plants that have pollen, so allergies can become worse and things like that. And so it's absolutely related to climate change.
And there's also the physical adaptation side to it, right? So if you look at studies looking at when people get sick from heat, there's way more presentations to the hospital early in the season before it's been hot. And it's because you're coming out of that winter adaptation and moving into summer. So May, June tends to have much more heat illness than July, August, September. And it's just because you don't have, so if you're constantly moving back and forth, your body doesn't have any time to adapt to the temperature. And so all of those things together, very much, it's climate change. You can just say that. Yeah.
You're not crazy. Sorry, I can't see. There was somebody. Okay. There you go.
What's your experience with the intersection of climate and mental health, especially around kids? I know there's been a lot of really cool research out there. But yeah, I would love to hear your personal experience with that.
So I did residency in both internal medicine and pediatrics, so I definitely have a little bit of background in that in terms of, kids are paying attention. they see what's happening, right? They listen to the news. They may not completely, I mean, depending on their age, they may not completely understand what's going on, but they see how it's affecting them. There's increased rates of anxiety, depression, suicidal thoughts, all related to this existential threat that they're experiencing, you know? And so there's huge, there's a lot of mental health effects with regards to children. And I think the one thing too is the connection with nature. And I think we've talked about this a little bit, but I think in our society, we're becoming more far removed from nature, and that's affecting kids' mental health as well. Gayle, you had a really great way of framing this, so I wanted to kind of pass it along to you because she has a really great way of saying this. But yeah,
So I think we like all know inherently that nature is good for us. Like, how many plant parents do we have? Right? Like, who doesn't have cute plants that they love? And like that in and of itself is nature, right? You're connecting with that, and that is so powerful. I wish Allie were here. So one of our co-fellows, Allie, is a pediatrician, and she is doing her own. She started her own nonprofit that is using ecosystem restoration as a way to improve mental health in kids. And it basically takes this group of kids who are in school, and they found this little plot of land outside of Seattle, and they are going there and restoring the landscape. They're removing invasive species, they're planting native species. And it's just this whole conversation of like, this is the land that we are from, and here's your mom, right? Let's reconnect with our mom. Let's help heal her, and on that way, like, we're healing ourselves. And so I think that anything that we can do to go back home and like go back to our mom, like, I think it's so powerful.
and not only that, they're like creating that sense of community, and like they're working towards a shared purpose. So that social connection is huge for their mental well-being. So that's another.
I mean, I'm telling you, we could do this all day, right? Like, it's endless. Unfortunately, we've run out of time. I'm so sorry. Thank you, ladies, so much for being here.
Thanks for having us.
Thank you.
Yeah,
Great.
of course.